from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6/24. October is Breast Cancer Awareness Month, as many of you know, and breast cancer is one of the most common kinds of cancer in women. The good news is that most women can survive breast cancer if it's found and treated early. Joining us this morning to help raise awareness is Baptist Health's Dr. Devon Ballard with Sherwood Family Medical Center. Welcome. Thanks so much for being here.
Yep,
this is the month that we're going to talk a lot about breast cancer, and for good reason. Breast cancer, very common.
Correct. Like 1 in 8 women will get breast cancer in their lifetime. So like if you have 80 Facebook women friends, 10 of them are going to get breast cancer at some point in time in their life, which is, that means 7 out of 8 aren't going to get it, but 1 of 8's, 12+%. So it's a very, very common disease. The most common cancer in women other than skin cancer.
So definitely something that we need to be talking about. So when it comes to mammograms, we all know that we should get one. What does Baptist Health recommend for women?
Starting at age 40, routine screening for women at 40. The indication to do it early if you find something, not just screening, but if there's a lump that's found early, do it early, or if there's a primary family member with breast cancer, like a mother at 45, you would probably start screening at 35, kind of the 10-year rule. So you do it early for certain conditions, genetic-wise, but in general for the routine population, 40 years old is the routine screening recommendation time.
Self-breast exams, we've heard different things about this. Is this something that women should do on a regular basis?
Oh, you should be doing 2 or 3 times a month. Just getting, even starting when you're, I try to teach women when I'm doing their pap smears how to do an exam at 18, 19, 20. So you're used to your own tissue, so you're used to saying, oh, it's been there for 25 years, or this is new. And so you get, we do exams once a year, but a woman can do exam 40, 50, 60 times a year and find things that come to me and say, hey, I felt this new thing, and let's just figure it out, see if it's something we need to be concerned about.
That needs to be a conversation with your doctor on a regular
Correct.
Basis as well. Okay, technology has changed so much over the years. One of the reasons that we are able to detect breast cancer earlier.
Correct. So, mammograms, everybody hears about getting their mammograms done, but there's some new technology. I think Baptist is coming out with it next month. It's called the ABUS 2.0. It's a 3D imaging for the breast. It actually is able to detect breast cancer in denser tissue, because women either have a denser type breast, like a fibrocystic type breast, or a fattier type breast. So some of the denser type breast is not as specific with mammograms, and a lot of times we'll have to get an ultrasound. But this new ABUS 2.0 was supposedly going to be a lot more specific to find earlier cancer.
Exciting news, but women have to go out there and get those mammograms. That's
Correct.
the message this morning. As always, thanks so much for being here, and it is Breast Cancer Awareness Month. You'll be hearing more about that and about the More Than Pink race that is coming up later this month.